Germany is extending its national coronavirus lockdown by 3 weeks in an effort to reduce stubbornly high infection and death rates. Chancellor Angela Merkel and regional leaders also agreed to tighten some restrictions, including curbs on social contacts and limits on people's movement in the worst affected regions. Germany's latest official figures show over 21,000 new infections and 1,000 deaths, underscoring the situation's urgency.
Germans have been feeling the effect of tougher corona restrictions since last year, but the lockdown is about to get tighter still. We're going to extend the measures which we agreed in December until the 31st of January. And in some areas, we will have to introduce even tougher measures. Infection numbers have not dropped as sharply as hoped, and there is a new fear of the faster spreading variant of the virus, which could put massive strain on the healthcare system if it takes hold in Germany. There is really major concern about the virus mutation. If it's true that mutated viruses tend to displace the existing strains and are more aggressive, we could be facing difficult times ahead. What's happened in Great Britain shows we must not underestimate this. And so the Chancellor and State Premiers have agreed an extended lockdown. Private meetings will be limited to the members of a household and only one other person. Where infections are high, people will be told to stay within 15 kilometres of their home. Schools and many shops will remain closed, and people arriving from outside Germany will need a corona test and have to spend at least 5 days in quarantine. Restricting movement in infection hotspots could prevent a repeat of scenes like these at the weekend, when hundreds of people ignored police warnings and headed for ski slopes. But so far, it's not clear how all the new rules will be enforced. Hopes for progress in rolling back the pandemic now rest on vaccination. New vaccines are set to be approved, but it's expected to be many months before enough people are immunised. For now, Germans face a longer lockdown and no clarity about when it might be lifted.
Well, for more now, I'm joined by Janosch Dahmen. He's a doctor and also a member of the German Parliament for the Green Party. Dr. Dahmen, do you support the new coronavirus restrictions announced by the German government today, or yesterday, rather?
Good morning. To my opinion, the resolutions are definitely necessary, but also they are not sufficient. I'm very concerned as a doctor that we don't have a long-lasting crisis mode already. And when I look on the resolutions from yesterday, there are 3 devastating gaps in political action, which I think are really definitely necessary. Firsthand, we urgently need rapid testing as a self-test for a working public health screening. Second, we need to get faster with vaccination. And third, we really need a working strategy with contact tracing, which still is a lack of a sufficient strategy over here in Germany.
Let's talk then for just a moment about the vaccination strategy, because many are criticized the government's policies as being too slow, the rollout of the vaccine. What do you think could have been done better there?
Well, if we look at the numbers, Germany has only vaccinated about 24% of all available vaccination units at the moment. And this is not enough. We really need to scale up these numbers. And the most important part is to vaccinate the more older people. And if we think about our own grandparents, we know they have restriction in movement. They have difficulties to get an appointment. And it would be much more sufficient to bring vaccination to the older people by using general practitioners as part of vaccination teams. For example, then bringing those old people to the vaccination centers, which doesn't work, unfortunately, at the moment.
In terms of testing, what do you make of the government's strategy? You say home testing would be a good idea, but in a case where you have 20,000 new infections on a daily basis, is it even possible? Does testing help in that situation?
Of course, because testing is our only chance to interrupt infection chains. And at the moment, we only test basically people with strong symptoms, but we don't test those people who did have only mild symptoms or even are just like contact person to a symptomatic COVID-19 patient. So basically, we need to scale this part. And with new rapid antigen tests, there would be a possibility for everyone to do such tests on their own. But this is not allowed to German law at the moment. And this really needs to be changed to have a sufficient public health screening.
You say that the German government should impose even tougher restrictions. What sort of restrictions are you talking about?
Well, I certainly don't understand why we, on the one hand side, send pupils from school home and they are not allowed to enter their schools. But on the other hand, I see on daily basis like crowded big offices where people are forced to work even without sufficient occupational safety measures to work there, instead of a standard of home office work, which should be not just like a possibility, but the standard of work over here in Germany.
Ms. Dahmen, Dr. Dahmen, thank you very much for talking with us. That was Janosch Dahmen from Germany's Green Party, and he's a member of the German Parliament, the Bundestag.
Thank you so much.
Joining us now for more is Markus Ogorek. He's director of the Institute for Public Law at the University of Cologne. Thanks for joining us this morning. First of all, Professor, what do you make of the government's move to restrict freedom of movement to within 15 kilometers of a person's home? Does that not raise legal questions about fundamental rights?
Yeah, good morning, and thanks for having me. Of course it does. Yeah, inhabitants of hotspots are not permitted to travel more than 15 kilometers from their place of residence unless they have a valid reason, such as going to work, to the doctor, or providing essential care. Day trips are explicitly not considered a valid reason. And there are currently about 70 districts nationwide where this value has been exceeded, according to the Robert Koch Institute. So I expect a flood of lawsuits, and in Germany, every citizen can take legal action against governmental decrees in two ways. First, she or he can appeal to special administrative courts, and in addition, he can file a constitutional complaint, and both are very effective ways in comparison to many other nations.
Okay, so you expect that to be challenged, the restriction on freedom of movement, but there's another newly announced restriction. It allows households to meet only one further person in private. What about that? How can that possibly be enforced?
Yeah, actually, I don't think it cannot be enforced. Nobody really can control these regulations. So that is why we need great acceptance in the population. Otherwise, all these measures will be in vain. They will not work. And I expect the police only to come if, for example, neighbors actively inform the authorities. But it is up to now, it is still unclear whether these new, tighter contact restrictions will be binding in private residences. That is something we do not know right now.
Well, Germany, of course, is a parliamentary democracy, but these measures are being imposed without parliamentary debate. What do you make of that?
We are amidst a national health crisis, so I completely understand that the administration wants to move forward and wants to move quick decisions that can be adapted to the current situation. But we should not forget that Parliament is the heart of our democracy. By questioning and challenging the government, Parliament can help to refine and to improve policies and their implementation. The parliamentary process itself lends legitimacy to the government's actions, in proving that they have been thoroughly considered and debated. That is why I want to explicitly emphasize that we need a stronger involvement of the German parliament.
And finally, the question of immunization. The vaccines are now being delivered. The rollout is kind of slow. Do you see any legal implications involved there? Any legal problems associated with that?
Of course, because someone will have to decide who will get the vaccine first and who will get the vaccine at a later moment in time. So this is also another question where I think we need parliament involvement because parliaments can use the lived experience of their constituents. So it's extremely important that the parliament has the last word and makes the final decision. And we should be very reluctant to give too much power to the administration with regard to these questions.
Professor Ogorek, thank you very much for talking with us today. That was Markus Ogorek, Director of the Institute of Public Law at the University of Cologne.
Thank you.
Let's take a look at some of the other developments in the pandemic. China has denied entry to a team from the World Health Organization trying to investigate the origins of the virus in Wuhan. Meanwhile, Chinese authorities have stepped up COVID restrictions around the capital, Beijing, following an increase in coronavirus cases in Hebei province. South Korea is rolling out mass testing for 70,000 prisoners and staff after a recent prison outbreak in Seoul, and as medical facilities in the U.S. city of Los Angeles struggle to cope with a surge of cases, ambulance workers have been told they should not transport patients to hospitals if their chances of survival are very low.